a mini research proposal by Aaron Stamper in the class Psych 610 Applied Social Psychology with instructor Matthew Hubbs on 30 June 2016. The proposed research question puts into analyzing the application of quantitative research and analysis to better enhance the flow of information that is gathered, analyzed, applied, and then redisseminated within the psychological community. This hypothesis is based on a full quantitative analysis of the psychological practice of research and treating patients in a manner that improves the gathering of information through the individual patient treatment, processing the data through a universal form that can be digitalized and redistributed back into subsection, the faculty and surrounding practitioners to maintain a better and more up-to-date form of treatment within the psychological community. This research proposal is a necessity on several different levels, to include but not limit to the ever-changing climates, the environments, and the stressors that we are exposed to on a daily basis. While it being important doesn't fully describe the reasons why we need to maintain a foundation of treatment that is not reacting to cognitive behavioral issues, but being proactive in defining new stressors and starting treatments during the early warning signs of disorders. Research is fundamental to the advancement of medicine and critical to identifying the most optimal therapies unique in particular societies. This is easily observed through the dynamic association with pharmacology, surgical techniques, and the medical equipment used today versus short years ago. Advancement in knowledge, synthesis, and reporting guidelines enhance the quality, scope, and applicability of results, thus improving health, science, and clinical practices and advancing health policies. Which leads me to believe that if physical medicine can maintain this rhythm, then the psychological community should be able to surpass it in a mere amount of years. This research design will come in two parts, experimental and non-experimental, as the experimental side will be that of clinical applications, but with some minor changes in how the data is gathered and analyzed during the initial stage, how the individual will be treated according to the findings of the data gathered, and reporting up these findings and applications to the non-experimental side for processing. It is there, in the non-experimental side, that the data will be gathered, compounded, and analyzed at a quantitative level, then applied to a statistical algorithm that fully processes the information in different sections of what is and is not working by age, sex, status, finances, etc., which is then organized and put into a presentation form to be distributed back out to the psychological community so doctors and practitioners can see a different side than just their own backyard. Being that this study is both experimental and non-experimental, access to the reports within the individuals being treated for issues like PTSD, depression, anxiety, and other prominent mental disorders can be pulled, processed, and fed into the quantitative algorithm, which means that a shared drive or a shared portal will have to be created in order to maintain the secure transfer of medical treatments and procedures of the patients. Although my expectations of this proposal are extremely high, I know that the first couple of years of data gathering, process, and redistributing quantitative treatments will be a struggle to solidify into a flowing system of working and applicable information. But in the end, I think it will be possible to apply this study into the community and have breaking discoveries being applied and distributed within days of successful treatment instead of months and years waiting for the article or book to be published. This concludes my proposal. Please feel free to comment, ask questions, or bring you up any concerns in the response section of this discussion format.